In the College of Health Professions, there are two major improvements that we're working on. The first one, the relocation of our dental hygiene clinic and program, has been on our shelves for a long time, and the goal is to relocate our program to 29th and Oliver in our School of Oral Health, where we have our Advanced Education in General Dentistry program. Now, the exciting thing about this project is that when the original plans were drawn up, faculty, staff, and students associated with the dental hygiene program had an opportunity to contribute to what the design would be. But of course, that's been several years, and now we're all happy that we have the opportunity to allow current students from all programs to provide input on how we can update those plans should this referendum pass. The second is in response to a lot of student feedback I get in terms of how do we improve the student experience in the College of Health Professions. And with the relocation of the dental hygiene clinic, we see an opportunity to turn that old clinic space into a student success center where we can provide more space for our advisors and also provide some spaces where students can kind of hang out and get their needs met and visit with each other. We like to call that yet another collision space in the College of Health Professions.